Good morning. My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being www.gianinc.com. Today's topic is erectile dysfunction. The word that was previously used is male impotence, but that is not PC to call it that. So what does erectile dysfunction mean? Erectile dysfunction is a male's inability to attain a full or partial erection that does not give him satisfactory sex. If he's unable to have a full erection or a partial erection and is unable to complete the sex act, that man suffers from erectile dysfunction. Before we discuss the causes, I'd like to give you a brief overview of the anatomy and physiology of an erection. An erection takes place, before I tell you that, the penis is made up of arteries and veins and spongy tissue. A substance called nitric oxide is secreted at the time of sexual desire. That nitric oxide dilates the arteries. The blood rushes in to the penis. The veins shut down to prevent the blood from draining away. And through very tiny, small arterioles, the blood seeps into the spongy tissue and the erection occurs. That is the basic anatomy and physiology of an erection. Now, the causes of erectile dysfunction are many. The physical causes are high blood pressure, sugar diabetes, atherosclerosis or blocked arteries, if one has had a kidney removed, excessive alcohol intake, or lack of exercise. The psychological issues are depression, anxiety, stress, and tension. It is figured that 40% of males over the age of 50 suffer from some form of erectile dysfunction. And that's a general age, but we have seen men much older having satisfactory sex, but that is the figure that is published. There's also medications that you take that can affect erections, and that is diabetic medication, hypertensive medication, medication for high blood pressure is well known to cause erectile dysfunction. Antidepressants. Depression can cause it, and then you're given an antidepressant, and that just aggravates the whole situation. So antihypertensives, antidiabetic medication, antidepressants are just a few medications that can cause erectile dysfunction. So now we've discussed the anatomy, physiology, we've discussed the causes. I think we'll discuss the treatment now. There's medical or therapeutic medication and non-medication. The therapeutic medication that one uses, we all know too well because we are bombarded on the television sets by the advertisements. And I find it ironic sometimes because they're told if you have an erection lasting longer than 4 hours, you must go to the emergency room. Well, I question, didn't you take the medication to have a sustained erection? And in lighter vein, a friend of mine once said to me about the blue pill. He said, if I have an erection lasting longer than 4 hours, she goes to the emergency room, not me. I thought that was rather hilarious. So we come now to the treatment. As I said, there's all those medications that you can take to enhance an erection. It's basically worked on the nitric oxide system to enhance the nitric oxide secretion. Another form of treatment is a syringe with a very fine needle. You inject the penis using this very fine needle, and the medication causes an erection. Some use this vacuum pump. Using a vacuum pump will increase the blood flow to the penis and an erection happens. But this to me can be distasteful. The male has to go into the bathroom and pump it up and then go to the room. Anyway, each to his own. And last but not least is the penile implant. And that is not very functional. The complications of that are pantheon. They have infection, the wound ruptures, they have persistent pain. There's a bag attached to the side on the thigh that the male has to pump it up in order to attain erection. So, if we see males under 40, I've even seen them in their 20s, they have no disease whatsoever. What is the cause? And invariably, there's a psychological issue behind their inability to have satisfying sex. Whether it was child abuse or sexual abuse, whatever, these things are revealed to us when we place the patients under deep hypnosis and delve into the subconscious mind. And once we have brought that to the fore and discussed that, somehow they are performing satisfactorily. And when a man's machismo is returned to him, his appreciation is enormous. So we have these boxes of single malt scotches and cognacs and finest cigars and gifts and what have you. It's just unbelievable, because a man is so grateful to be able to have normal sex. If you had to ask me, give me one thing to do and one thing only to improve my sexuality and improve my erections, the answer is very simple: exercise. Exercise, but not just the normal type of walking. You have to have strenuous exercise, increasing the pulse rate to high values, perspiring, breathing in and out with labored breathing. At that point, you get secretion of the endorphins, or the feel-good hormones. If you have been exercising and you're used to it, and you're suffering from erectile dysfunction, increase the speed and increase the duration. If you haven't exercised, then start off slowly by walking a half hour and increase till an hour, and once you've achieved that, start increasing the pace until you walk fast for 1 hour and you come home in a method of perspiration and what have you. That is the single most beneficial thing that one can do to improve their sexuality and their erections. If you have any further questions, you are welcome to email me at drhm@gianinc.com, Dr. Hillel Mazansky at guidedimageryandnutritionincorporated.com, and I'll be happy to answer any questions you may have. I thank you.